Setting General Practice Clinic. You are speaking to a 49-year-old man who is undergone a barium enema earlier today. He presented 2 days ago with complaints of abdominal discomfort and change in bowel habits. You have his test result, which are unremarkable, but notice that he looks angry. Task 1. Find out why the patient is angry. Task 2. Ask if the patient is still experiencing any pain. Task 3. Explain that enema is generally not painful for people and probably that is why he was not informed earlier. Patient might have sensitive bowel due to which it was painful. Task 4. Empathize with the patient. Task 5. Explain that the purpose of performing the procedure was to examine his colon and rectum for cancer. Task 6. Reassure the patient that his results are normal and the doctor will see him shortly to prescribe medication for his complaints. Here, the setting is general practice clinic. So, we can introduce the patient by Good morning. Please have your seat. My name is Ashwati Mohan. I am one of the registered nurses in this clinic. In this cue card, we can see that the patient has attended our clinic before. So we need to check the name of patient. So we can ask by for the confirmation purpose, could you please tell me your full name and date of birth? When the patient says his name and date of birth, we can say like, how may I address you? So here the patient name is David John. So the patient may say like, you can call me David. Then we can move to our first task. We need to find out why the patient is angry. So we can say like, David, it seems to me that you are angry. Could you please tell me what's bothering you? According to the interlocutor card, patient may say like, yes sister, I am very disappointed about the procedure because the procedure was very uncomfortable and nobody told me that it can be really painful. I didn't expect this. Before moving to our second task, we need to acknowledge patient concern. We can say by David, I am sorry to hear that you have experienced pain during the procedure. Could you please tell me, did the pain last just while the procedure was happening, or are you still experiencing any pain? According to the interlocutor card, patient may say like, Sister, I am not experiencing any pain presently, but nobody told me that it can be really painful during the procedure. So I feel vulnerable and humiliated. We can move to our third task. I do really understand what you are saying, David. Let me explain you that. An enema is generally not painful for people, but sometimes some people might experience some pain if their bowel is too sensitive. Also, we need to empathize with the patient. We can say by David, I can sense that you had a horrible experience. I can appreciate why you are so angry. If I were you, I would react in the same way. According to the interlocutor card, patient may ask you by, oh, sister, why this procedure was prescribed for me. Then we can move to our fifth task. Then we can say by, I can understand your concerns, David. The reason doctor was advised you to have an enema because the doctor was worried about your symptoms and the symptoms were related to cancer. Then the patient may be alarmed about when you mention about the cancer. So we can reassure the patient by saying, David, let me reassure you that you have nothing to be concerned about. I'm glad to tell you that your results are unremarkable and it is not a serious condition. Then, according to the interlocutor card, patient may ask you the treatment for his complaints such as abdominal discomfort and change in bowel habits. Then we can say bye, David. Regarding your abdominal discomfort and change in bowel habit, the doctor will be here shortly and he will prescribe some medication to resolve your complaints. Would that be okay? If the patient is agree with you, you can ask by, do you have any other concerns? If the patient has no any other concerns, you can conclude our role play. Like David, I hope I have cleared all your concerns. Now the doctor will be here shortly. Thank you, David. Take care.